Well, hello and welcome to the 27th Degree with Chris and Nancy. Our guest today is Dr. Cojocaru, who joins us to discuss COVID-19 updates. We have had Dr. Cojocaru on the show in the past, and it was a great success. We had a ton of views. She spoke about COVID-19 some time back, but there's so much that has changed. We wanted to have her back to talk about it again. Before we begin our conversation, I'd like to thank our sponsor, Bay Coast Bank. Bay Coast Bank is just right for all of your financial needs. Visit baycoast.bank or call 508-678-7641 to learn more. I'd also like to thank Ron Gamache for our intro music and the PC Institute for producing our show. So, Dr. Cojocaru, tell us a little bit about yourself. Let's start with that.
Good evening, Chris. Good evening, Nancy. Good evening. So you can call me Anna. We're here like friends. And so I'm a pulmonary and critical care physician. I've been in Fall River area for over 9 years now. And I take care of a wide range of patients with respiratory problems, but also critically ill patients in the hospital. And now in the past 2 years or so, COVID patients and post-COVID patients. So majority of patients who have significant COVID disease in the hospital especially, they get a consultation from our team.
Right. So a lot has changed with COVID over the years. We had the original strain, and then we had the Delta variant, and then Omicron, and now there's a new variant out there too, which is becoming the predominant strain. So maybe we can talk a little bit about that, because that seems to be what we're seeing now mostly, rather than the other strains that now have become less prominent.
We're talking about Omicron BA.5, is that correct?
Yes. Right.
So this is a substrain of Omicron. BA.5 is the dominant one in the United States. We still see some other ones. Fortunately, Omicron in general is not as severe. It doesn't give us such severe disease. It's a little bit milder. And the reason is because Omicron has predilection to attach to the cells present in the upper airways. That means throat, nose, and mouth, and it has less affinity it likes less to stick to the cells deeper in our lung. That being said, if someone was not exposed in the past to any kind of SARS-CoV-2 virus, either through vaccination or with exposure to previous disease, they may have gotten infected, to have any kind of immunity. Some people still will get significant disease. And as we know, we do have deaths every day in America, due to COVID and Omicron BA.5. So definitely much milder. And there are many differences. One main one is that the monoclonal antibodies that we used as one of the outpatient therapy for patients with COVID, majority of monoclonal antibodies now do not work against BA.5.
Okay.
Yeah.
Why?
Yes, because those monoclonal antibodies are basically just to go and surround the surface of Omicron, of that virus, and now the surface of this COVID-19 and Omicron BA.5, the surface and the neutralizing spots basically mutated. So which are the neutralizing one? Ideally is the same spot that attaches to our cells and gives that virus the entry to the cell. So if you imagine that virus has a little key on the surface, it has to fit perfectly into the surface of a cell to open the cell to allow it to go inside. So that is basically the ACE receptor kind of, and that one has mutated significantly in Omicron and BA.5.
Okay.
And this is the one that if we use monoclonal antibodies, they're different. So that means that there are different surface epitopes. That epitopes means different little proteins, different little, chemical substrate that they're covering and surrounding. Now they don't work as well. So none of those are working really great the way they used to, unfortunately.
Anna, do we ever get ahead? Like, it always seems like we're playing catch up with
Yes.
the disease. Are we ever getting in front of it and be like,
I think will be unusual because we cannot guess which mutations the virus will take. Yeah, we always kind of catch up to it. The idea is to have majority of population to some degree immunized because you will have some degree of immunity. Even now, we know that the usual vaccines that we had, majority of U.S. population received either Pfizer or Moderna mRNA vaccines. Yeah, we know that they are less effective with Omicron and especially with BA.5. They're less effective, but they still have some protection. And also now we understand that having previous history of disease, it can actually give you some protection as well. It's not that it's good that you had the disease because we do see now a lot of side effects from the disease. Yeah, people are concerned about the vaccine giving side effects, but now we see long COVID, post-COVID issues, even in people who had vaccination, and those are actually much more serious.
Right.
Yeah.
Anna, can I ask you a question with a couple of different scenarios? So if I'm someone, and I've heard the phrase like a COVID version, like you've just never gotten sick, you've never been diagnosed with COVID. Now, for those people that have not gotten COVID and are not vaccinated, they should still get their like if they want to wait and they're like, okay, I feel more comfortable now. Everyone has, like a lot of people I know have gotten it. Now, are the push is to still get the original vaccinations, right?
No.
Or have the vaccinations changed?
Yes. So fortunately, we do have a new vaccine. It's the Novavax that was recently approved for emergency use in the U.S. just a few weeks ago. So Novavax is basically a classical protein-based vaccine.
Okay.
So this is a vaccine that a similar vaccine that we used for decades in the United States and all over the world. Basically, is a protein-based vaccine similar to our hepatitis B vaccine that we've been using for many decades. And in healthcare, everybody gets hepatitis
it's not
B.
Controversial. Like
It's not
mRNA.
controversial.
Right.
So this new Novavax vaccine basically should give a little bit of peace of mind to the patients who are reluctant to receive vaccines, a new vaccine like mRNA vaccines. And we hope that I think it's over 20 million people still in the U.S. who did not receive any vaccination.
Right.
They should be at ease in a way because, again, hepatitis B, and varicella zoster, actually. The zoster vaccine is similar. And these are vaccines that people have received for so long, and it doesn't use any of this new technology. So in a way, it's proven to be safe. And hopefully that will make it easier for healthcare providers to convince their patients and patients to be a little bit more comfortable to receive. So they approved now this new Novavax vaccine, and the beauty about this new vaccine is actually works pretty well against Omicron.
Nice.
Was
So-
it based off Omicron?
No, it's based on the original. Did not include actually the Delta or Omicron, but they now looked at some coverage and across Omicron, people who received the vaccine in clinical studies. It has shown to actually help. The initial results were like helping over and preventing over 90%. And now I think with Omicron, it decreased to 76%, but it's still pretty good protection.
Okay.
And it's 2 shots, a few weeks
shots, so-
apart, and is recommended to everyone who did not receive any vaccines. And again, is a safer, in a way, vaccine because we've been using similar ones for many decades.
And the pharmacies have this now?
So we should, I'm not sure, but has been approved and we should be having it available. So is Novavax vaccine. Yep.
So, and if I had the original vaccines, and say I didn't get my boosters, say I just got my vaccines, what's the next step for me? So someone that hasn't had COVID, got my vaccines, didn't get boosters, what's the recommendation?
So the recommendation is to get a booster. Now, the question is, when is the right time to get a booster,
Right.
So should you get it now, okay, when we know that original, which is mRNA, either Pfizer or Moderna, may not be as good? Or should you wait until later? So it depends. So number one, that I'll ask you, how long ago did you have your last vaccine? So if it's been over a year or 6 months, some people will say 6 months or more, then you probably, majority of people will not have this long-term immunity.
Okay.
Although some memory cell immunity, I would say, is still there. You may not have antibodies. It does not mean that you don't have memory cell immunity. You probably will have that, I would say that if you are at high risk to develop severe disease, okay, so you have to have all of those comorbidities, age, comorbidities like obesity, diabetes, maybe cancer, maybe immunotherapy, chemotherapy, then I would recommend to get a booster now. But if you don't have those risk factors, I'll probably say wait until we get the COVID booster vaccine that includes Omicron. And that should come out from Moderna and Pfizer in September. This is what they say, that we're going to have, yes.
I can't wait.
We cannot wait, exactly, because this is what I'm waiting, and I've been telling majority of my patients, you've been good, you've had your maybe one booster,
Right.
Just now use precautions, we should not let our guard down. It's summer, is warm, have a parties outdoors, wash hands, put sanitizer, make sure that you tell people, if you're ill or have a sore throat, just stay home, don't come. It's just safer for everyone. And then in September, when we have that vaccine, then get your booster.
That's what I've been telling patients too. Ones who have been vaccinated, they're thinking about getting their last booster or their first booster. I've been telling them to hold off if they're not really terribly ill.
Exactly. Yep.
Do people sometimes people in their 40s, 50s that are pretty healthy and, feel like they may be invincible and COVID's now not at the forefront of their mind anymore. Are they still recommended to get their boosters too?
Absolutely.
Okay, so it's
Yes.
not just for the high risk and
No.
you're getting a little on the older side.
It's for everyone.
For everyone.
Yes.
All right.
And for those healthier patients, I would say, again, it's okay to wait for a few months unless they have all those risk factors, and they need to discuss it with their doctor, their primary physician.
Right.
Yeah.
Well, that's really the key point. They should have
Absolutely.
a discussion. Absolutely, because their doctor is going to know more about their health.
Absolutely. Yep.
Exactly.
As doctors, what are you seeing for symptoms now with the COVID strain that's out there?
Well, I mean, I've been seeing a lot of the similar symptoms than I saw before, though less of the kind of the, we're not seeing people with the lower respiratory stuff where they're getting pneumonia as much and really ill in that manner. A lot of sore throat, a lot of terrible headache. I'm still seeing some loss of taste and smell.
Correct. Yeah.
So it's pretty similar in that regard. It doesn't seem to be as severe for many people, but the caveat to that is it seems to be much more contagious. So it seems
Correct.
to be much easier to contract than the original strain was. So, there's a trade-off always, right? It's maybe not as bad, but you can get it more easily. I have a lot of patients, and they're very careful, and they get it, and they have no idea how they contracted it.
That's
because
correct.
They've been so careful for so long, and then they finally get sick, after years of being careful. So it clearly, and we know this is not just anecdotal data. We know that it's more easily transmitted.
That's correct. Yeah. It's easier transmitted, and thank God it doesn't really affect the lower respiratory tract, but gives more systemic kind of manifestations. Yeah.
A lot of aches and just feeling terrible, like terrible flu symptoms.
Yeah.
Yeah.
Yeah. And there are other treatments out there. I say prevention is the best kind of medicine. We
Right.
wash your hands, stay out. If you go out and eat, there's a lot of outdoor sitting,
Yeah.
and we should continue doing that. Also, don't forget about the healthy habits like exercising and taking those deep breaths and walking in nature, because that can help. Eating healthier foods where you include vitamins and vitamin C, because I think that it does make a big difference. People who have poor diet have weaker immune system.
Right. I agree.
That makes sense.
Stay away from the fast food. Stay
That's
away
right.
from the junk food. Don't overindulge in alcohol. All
Yep.
that weakens the immune system.
Correct.
Yeah.
So now, when someone tests positive, what other treatment options that you guys are looking at?
Well, I've been using a lot of Paxlovid.
That's correct. That's the best medicine
I
out
think
there,
for
with
patients-
caveats.
Yeah, with caveats. For patients, this is how I've been approaching it for patients who.
And do they have to be like sick?
Well, no, I mean they're if they're young, they have no risk factors and they're doing fine and they're minimally symptomatic. I don't give them the medication because there are, potential side effects with any medication you use. But if they have symptoms that are notable or they may have some risk factors, I absolutely would use Paxlovid without any concern. You just have to look at kidney function. You have to look at other medications they're on. There are some, there's quite a few medication interactions you have to be aware of, and the pharmacy helps with that too.
Absolutely. And these interactions and these medications, common medications are out there, it is on internet, but is in our medical, subscription and our prescription kind of pops up for us and for pharmacists. And, occasionally we'll have to stop a medication that the patient takes, for a few days just to give a Paxlovid, and that's okay. But I would rather treat than non-treat in a patient who may have an increased risk, especially if they're not vaccinated, because again, we still have deaths, and it's just better to prevent worsening. And we know this medication helps. It's an antiviral. I tell patients, this is your Tamiflu for COVID.
Exactly.
Yeah.
That's a great
So
way to-
Tamiflu helps for flu. This helps for COVID. It kills the virus.
Nice.
And now there's new data coming out to know about this rebound when people, after, because and the reason, so what is the rebound? People get COVID, we get this Paxlovid, and it kills the virus for 5 days, and then after 5 days, we stop this medication, and then the viral load again starts growing and going up again, and people from negative become positive, and they become a little bit more sick. They start having recurrent or rebound symptoms of COVID. And that can happen now. They describe it in BA5. And the reason is because the initial studies for 5 days were done in not so fast, for COVID that was not multiplying so fast. And now, it just rebounds so quicker. It doesn't happen in everyone. It's about 20%, maybe 1 in 5 people, but it does happen. And sometimes people need something else. They cannot, take it on their own. I heard different scenarios, what patients do after that, but I would say the best thing is if this happens, you need to reach to your primary physician, to your doctor who prescribed that, because they will know what's best. Because it could be from post-Paxlovid, your viral load was not brought down enough where your immune system can control it.
Right.
So now it's bouncing a little bit back, but it also could be a bacterial superinfection.
Right.
It can be it could be an exaggerated immune response. You can be going into a cytokine storm. Maybe you need to go to the hospital. So your doctor will ask you the right questions to figure out which way you're going to give you the best treatments.
Right. You
Because
don't want to assume.
You don't want to assume
Exactly.
that it's just from Paxlovid. It still works in a lot of patients, and we definitely know prevents hospitalizations, prevents moderate to severe disease. And again, if you prevent more severe symptoms, that will we know that it can prevent the long-term side effects from COVID, which are much worse than we ever imagined. Okay, I have now a lot of post-COVID patients who are suffering for a year and a half later. And that's no joke, I think that is very important to keep that in mind. You don't want to be suffering long-term
Suffering
I
how?
agree.
Different things, numbness, neurological symptoms, inabilities to sleep, irritation, difficulty, shortness of breath,
Brain fog, fatigue.
So why does that
Yes.
happen, or do we not know that yet?
Many reasons. So in clinical studies with animals have been shown that this virus, after a few hours of infection, is detected in your CSF fluid. So this virus can go into your fluid around your brain. It can go into your nerves. It can do a lot of things. So it can be a lot of neurological stuff that is.
Yeah, I've seen a lot of really bizarre neurological
Yes.
things that have occurred. So it's not just the fatigue. There's a lot of other neurological stuff that can happen. And the brain fog or the cognitive stuff that happens
Yes.
is very concerning.
Yeah. Yeah.
And we see that quite a bit.
Is in pulmonary literature, just talking about the lungs, but shortness of breath in up to, they say 5-10% of the cases, and some they discovered that it affects the vagal nerve and the diaphragmatic nerve, and actually you can get partial or complete, nerve paralysis of a diaphragm, and people have shortness of breath.
Right.
So this is like proven.
Right.
Yeah, it's
That
very
you can
interesting.
get-
Yeah, I've had a number of people, just like you say, who've had shortness of breath and they have clear X-rays, and there's nothing really identifiable, but
Yep.
they are really limited in their ability to exert themselves.
Yes. And sometimes doing a breathing test is important in these people, because I've had, to give an example, a young patient who's in early 40s, never any problems. And we did the breathing test, and it was basically with significantly decreased gas exchange capacity, where it shows that there's some degree of damage at the end of a lung tissue, is more bronchiolitis and more interstitial stuff. And he was okay. He started improving, but then later on he was diagnosed with an autoimmune disease. And that actually can affect the lung. So I don't know if that is from his post-COVID, or is it triggering an autoimmune disease? Again, there's another controversy that the virus can actually trigger autoimmune problems.
Absolutely.
And rheumatologists and our great
And I'm
rheumatologists
seeing
here
a
will
lot
tell
of
you.
that also.
Yep.
A lot of autoimmune type processes. I mean, it's such an oddball disease. I mean,
Absolutely.
this spectrum from basically completely asymptomatic to death and everything in between. There's nothing that I know of like that.
Yes.
Really.
This virus just, it completely turned the whole, I think, medical society upside down. We learned so many things, and we're like shocked.
And we're still learning. And
We're still learning,
We
that's
will be
right.
learning years from now.
Absolutely. Absolutely.
So then the long-term effects, it's not like everyone you're like, oh, like he'll probably get long-term effects. It's like people that you're not thinking that still get long-term effects from COVID, right?
Well, I think what you're asking is, can you predict who's going to get long-term
Yes.
effects?
Yeah.
I personally don't think you can really predict who's going to get long-term effects, although I guess if they have serious disease, there's probably
Absolutely.
more
More
chance of that.
But still, there's those surprises.
you know,
every
the
so often.
asymptomatic patients obviously aren't going to get the long-term effects.
That's correct.
But it is very hard to predict who's going to get really
That's
sick
right.
and who's
Because
not.
we had patients who had, mild to moderate disease, never got hospitalized,
Right.
and they have these long-term effects. And then, of course, it's obvious that we say if they had severe disease. I have another patient who's my age and who was on ventilator for 6 weeks, and then it took him weeks and he needed trach and peg and all of that. Thank God he survived, and he's doing absolutely fantastic. He's grateful for the chance that he got. But, he's far from being normal and having a normal life.
Sure.
And lung capacity, of course, and all of that, but it is pretty damaged, and he's recovering, and I see great improvement, and we're so happy. But again, in this patient, people will expect kind of problems because
Right.
he was ill for so long.
Right.
But sometimes, even moderate disease as an outpatient, you can get
Right.
some side effects. And what is interesting now, we've learned and we know that if you have recurrent COVID disease, like second and third time, if you had, after the first one, some long-term effects like post-COVID and maybe went away even,
Right.
if you have a disease the second time, you may actually have recurrent long-term issues. So if someone, I was thinking, I got vaccinated and I had the disease, and if I get the COVID, Omicron now, I will just boost my immune system. Now with the data coming out and say, no, you can get post-COVID more long-term effects. I'm like, oh, no, I don't want it. So now I don't want to get immunized, naturally again.
Right. That's a really interesting point you make up because there's a lot of misinformation out there. I was reading something recently. This was not in the medical literature. This was, in the kind of the lay press. And the argument that the writer was making was that since Omicron is not as severe in most cases, those who got it are lucky. And I thought, I don't think so, because a lot of those people are going to have long-term effects from this. But I hear that argument a lot.
Yes. So it's not for everyone. Okay. So maybe some of them will not have anything.
Of course.
Because we know that long-term side effects from COVID is not everyone.
Right.
Not everyone develop them, There were some numbers I cannot recall right now, but I think at one point we were saying even over 40% of people, like really not like 5 or 10%, but a pretty big chunk of people having disease until Delta. Okay, I cannot talk about Omicron until Delta, until like say January, 6 months ago. They had long-term side effects. Long-term means over 6 months, and they were persistent. Right. And at that time, we knew that those people can get affected. Yeah, those people who had that, only 20% or 40%. Yeah. Now with Omicron, could it be that will be less? Yes, it may be less, but you still probably can get long-term side effects. Yeah. And my concern is more in people who had the disease before.
Right.
Because now your body reacted and your immune system overreacted. What is the long-term effects is your body overreacts to things and gives more systemic inflammation.
Right.
And if you re-expose yourself, your body can think that you are getting COVID back and will start again. Your immune system will start fighting it,
Right.
Yeah.
Fighting it again, and it may bring back those antibodies that you don't want. Again, we do know from some small studies, observational, that after the disease, we discover a lot of autoantibodies. Low rate, low level, but basically this is a systemic mild degree of inflammation,
Right.
and that's antibodies, proteins that fight against your own cells, which is not good for us.
No, and we know that systemic inflammation is associated with heart disease and a host of other problems that
Absolutely.
are potentially serious. So these are really critical things to think about. Absolutely.
Yeah. And definitely, more common with a disease than with a vaccine. I have to say that, people
Right,
are concerned
of course.
about side effects of vaccine, but get what? It's 10 to 20 times more common in the actual disease.
Absolutely.
So yes, the vaccine is not perfect, but I'll take the vaccine anytime
Right.
to the disease, because disease is so much more complicated and unknown.
Yeah, and I think what's happened now is, and tell me if you agree, but because we've been doing this so long, we've been fighting this battle for so long, there's so much fatigue out there. And because, this variant is maybe a little milder in some cases, I just don't see people even wearing masks like they used to. They're not even trying anymore. And, granted, we're not seeing as many really sick people, but I still think there's a lot of COVID out there, and we don't know what the long-term effects are.
Correct.
And one of the problems we have really right now is people aren't going for formal PCR testing. They're testing at home, or they're not testing at all. We don't even know we don't have a handle on the numbers really.
Absolutely.
And that's a problem.
Just bringing in the home testing that you talked about, and now we know just anecdotally that the home tests may not be as good
Right.
detecting the Omicron BA.5. We still have a PCR testing here at Primary Care in Fall River. I think that if someone is negative, it does not mean you don't have
Correct.
it. You should repeat the test maybe another 24 hours later. And if you still have symptoms, you probably should call your primary and just get a PCR test.
Right. I've
It's
seen
just
that
better
quite a bit.
off.
I've seen patients who've tested for 2-3 days in a row, had negative home tests. We send them for a PCR, and it's positive. And they had all the symptoms, and the suspicion was that they had it.
Yep.
But they kept testing at home. So the test at home, I'm not saying it's useless, right? But if it's positive, you have it. if it's negative, you don't necessarily not have it.
That's correct.
And you have to go for a PCR if the suspicion is there.
Absolutely, especially when we know that at this point we really don't have a lot of other respiratory viruses going crazy.
Right.
Maybe we'll see in October, November, yeah?
Right.
But now we don't. So it's still COVID around.
Right.
So right now, if I'm looking at the vaccines that are coming out, it's like vaccine season too. I guess I'm going to back up for 1 minute though and say, are we expecting to see rates rise in the fall and winter? Is that
Absolutely.
something that's
Yes.
going to?
People would be indoor more, so
Yes.
So it's going
probably.
to. So then, you go into the doctors. Hey, get your pneumonia, get your flu, get your, your
Right.
your.
COVID is on my list.
But
You need
is there
to
like
get your
an
COVID
order to
vaccine.
that, or just do I give you my arms and you go for it?
No.
Well, they're not going to get the COVID vaccine at their doctor's office
That's right.
anyway. They have to go to a pharmacy for
How
that.
come still?
The new Novavax, though, I have to say, although Novavax is not approved for people who had vaccinations, it's not a booster at this time. It's only for people who never got it. But the Novavax, the good thing about it, it can be stored in regular fridge.
Yeah, it's the storage issues.
That's right. That's
okay.
right.
It has to be stored in, I'm not sure the exact temperature, but it's a special...
Minus 20,
minus
at
20.
least.
And we don't have that ability
That's right.
in our offices.
God.
So
Yeah, yeah. And pneumonia vaccine, people ask, is not every year. Okay? And it's not for everyone. If you're under 65, you should not get it unless you have specific meeting criteria that you meet. If you have lung disease, if you have cardiovascular disease, so your doctor will know. But 65 and over, you get, at this point, if we have Prevnar 20, so we give only one.
Yep.
Before it was 2, Prevnar 13 and pneumonia 23 vaccine. And then you can give it at 5 years or not at all if you're healthy. So it's not like pneumonia shot is like every year.
right,
Yeah.
right.
Yeah. So the flu shot should be every year. And now this fall, I definitely say that people need to get the COVID vaccine with Omicron protection, either the mRNA Pfizer Moderna, if you had previous vaccination, okay, which will include Omicron starting September, they say, or if you've never been vaccinated, you should get probably the Novavax, which is an old type of vaccine
Yeah.
with 2 shots. And that gives you some Omicron protection. And that hopefully will help us so we don't have that big spike in COVID disease usually starts around Thanksgiving, and then we get to drown ourselves in the hospital. I'll tell you that last year, after a year and a half, we thought it was going to be better, but, in a small hospital like St. Anne's, almost half of the beds were with COVID.
Right.
70 patients with COVID. Yeah, we ran out of ICU beds. Charlton Hospital were turning away patients with COVID. So it was still there. And of course, was Delta. But I don't know what's going to happen. And more mutations may happen.
Right.
And especially mutations now, if will happen, we suspect is going to be from what? From Omicron variant. A mutation because we have BA5, it's going to be BA9, BA10, I don't know.
Right.
But getting a shot and a vaccine that includes this Omicron is going to give us much wider and broader protection, and is going to be basically for you and for your community.
Right.
Yeah?
Right, and the mutations occur because the virus has been allowed to replicate.
That's correct.
If everyone had been vaccinated initially, we probably would not have this as
Absolutely.
we do now. But
Yes.
unfortunately, I think we're stuck with it now.
We're stuck.
Yeah.
So I'm going to ask you to probably repeat yourself
Sure.
one more time. So if I got my vaccines and I got my boosters, say 5 months ago, what am I looking to do come the fall? Anything?
Are you healthy right now? You don't have diabetes, hypertension, and otherwise good and healthy?
Well, me personally?
You're asking. Listen, you ask me what you should do personally, so I'm asking personally.
Okay, so say I have one comorbidity. Maybe I'm a little chubby.
Okay, but do you have anything else like high blood pressure, diabetes? If you don't have pre-diabetes, diabetes, just a little bit chubby, it doesn't mean much, because some healthy people can be a little bit chubby because they have strong muscles and you were like a boxer all your life.
That's
You know what I mean?
Strong muscles.
Yes, strong muscles. It depends how built you are, know. And I would say that you could wait if you're otherwise healthy and just get your Omicron booster in September.
So if I was a Moderna or a Pfizer girl, then they're coming out with a new
Yes.
booster in the fall.
That's
and
correct.
That's what I'm going for.
That's right.
Now, if I've gotten vaccinated but haven't gotten my boosters, then can I get this Novavax booster?
It's not approved as a booster yet.
Not
It's
as-
improved
okay.
only for people who never received a vaccine. I think they're seeking that approval
Okay.
for a booster for anyone, but it's not approved to give it on top of mRNA vaccine.
Okay.
It
All
was just approved 2 weeks ago. So
Okay. And then if I have diabetes and hypertension and I've got vaccinated and gotten my boosters, then I'm looking to.
and if you never had the disease, if you had the disease, okay, if you had the disease and the vaccines, I would probably wait still.
Okay. And if I haven't had that I know of, if I
That's
haven't
right.
had COVID.
You'll probably get the booster.
Okay.
Yeah. And the reason I would not say to get the booster right now, unless you're severely immunosuppressed, like
Yeah.
chemotherapy and really severe
Right.
stuff, is just because we know that the original vaccine and now the booster against BA5 doesn't work very well.
Okay.
And giving it to you really is going to make a difference. I would say to concentrate on prevention. Those will be the people who will say, be careful, still don't go out, you use your precautions, take your vitamins, eat healthy, have zinc next to you, one tablet a day, once a month for 5 days. Vitamin D, people who have low vitamin D levels is not clear, but we know that if they have in the hospital of COVID and lower vitamin D level, for some reason, more severe disease.
We notice this in the nursing homes because we put pretty much everyone on vitamin D in the nursing homes because they don't get outside and they don't get any sun exposure. Yeah. But there's still, despite that, there are patients who have low vitamin D levels, and it did correlate with more severe disease.
Yeah. And, they say normal, and we have it in the lab, is like 25, I think, level. Ideally should be above 50.
Yeah.
Okay, so if I will be the patient or the physician, I would choose to go to a higher level. Yeah, because vitamin D at, up to 80, they say is normal range, but 25 to 80 is really a wide range,
Right.
I would want to keep it at 50 or above that.
Okay, so then if I'm stopping at the pharmacy on my way home to pick up all these vitamins, what am I getting?
Well, you should definitely talk to your primary care physician first and get advice.
Yes.
But, I can tell you, I take vitamin D every day.
Okay.
I take some C. Whether that works or not, I don't know.
Yeah, but
it's not going to
if
hurt me.
If you like your spinach and your kale salad, that's a lot of vitamin C right there.
There you
Kale
go.
has a lot of vitamin C.
But I think D is the more important thing. I do take D every day. And what are you doing with zinc? Are you taking zinc regularly?
No, not every day. So I recommend my patients who have respiratory problems, to either take it when they feel like something is coming along, 1 tablet a day for 5 days, or to make it like a scheduled, every month, 5 days of a month, you take 1 pill of zinc a day. It can give you nausea and stomach discomfort, so it should be taken on a full stomach. And make sure it doesn't interact with other things because it can interact as well.
Yeah, the interesting thing about zinc is that if you look at the FDA regulations, it's 40 milligrams a day as max, and mostly every supplement you find is 50 milligrams. I don't really understand that.
Yeah, because it's probably absorption is not very good, but also in a lot of studies that they say
Right.
that we're zinc deficient.
Right.
I would not recommend it every day because, I don't know, I didn't hear about zinc overdose, but I don't think it's necessary.
Well, it can, if you take too much, it can block copper absorption, and there can be some other issues that can occur. But
Yeah, but
I think
5
you
days.
really have to overdo it.
That's right. But doing 5-7 days a month,
Right.
and if you come to have like some upper respiratory, I've been using it for years, and for my kids, when they come with runny nose from school, everybody gets a pill of zinc on their dining table, including my
Oh,
husband
you're
and
running
I,
to the zinc.
and I will tell you that they're doing pretty good otherwise, and
Well,
patients will tell me. Patients
Right.
tell me that it helps, and this is where Zicam comes,
Right.
and it helps. It's zinc with vitamin C and other vitamins in there.
That's it.
Yeah.
Right. But it's interesting. Since this whole thing started, I've been fortunate. Personally, I have not even had a cold. And maybe it's the D, maybe it's the C, maybe it's a little zinc, but I think honestly it's the mask and the hand
Oh,
washing. I think
absolutely.
we can talk about supplements and vitamins, but this
Absolutely.
is the most important
Absolutely.
thing. There's no doubt.
Washing your hands and using the mask. Absolutely.
I agree.
What are the power foods? Like if you're not, maybe you're not going to take vitamins or something. And like you had mentioned, kale's really a good source of vitamin C. Like
Listen,
what are those great foods?
no food is going to cure anything. Let me put you that, okay? So just to want to make clear, it's not going to cure you, but it can help your immune system, your body to find natural immunity, natural power to fight it easier.
Right.
Okay. So anything that has greens, and yes, meat is good, but I'll tell you that meat is probably very unhealthy, especially red meat. Right. We need it to some degree, but after a certain age, I eat red meat maybe once a month now.
Right.
Fish. Again, you have to look at fish with other, metals and other things with mercury.
And whatnot.
Yeah. So, but if you get healthy foods, it should be organic or locally grown, fresh.
Right.
Yeah. And lots of greens and salads and, roots. Mm-hmm. People don't like to eat roots, but there are a lot. And there are actually a lot of, you can look up a lot of veggies and a lot of foods that have pre-probiotics to kind of, what is that is basically foods that can feed your good bacteria in your gut that has a big influence on your immune system. Yeah. Our immune system now, we discover that is your gut flora, right. And we thought even the lung that it has to be sterile. No, the lung is actually a big immune organ as well, okay? That's why we have this COVID effects in the lung, and it's not sterile, the lung. It has this good bacteria to balance it out. Yeah. So I think foods have a big impact, and eating, foods and including, vitamins, but also, let's say, garlic, why not? Or other things like artichokes is a good one, onions, garlic, all of those are probiotics and have antiviral, antibacterial properties.
Plus, you'll never get close enough to anyone to get sick.
Exactly. If you don't like the smell of it, so.
But, it's interesting. The whole gut microbiome, we could do a whole thing on
Absolutely.
That. But it's fascinating. But, definitely limiting alcohol is important. Exercise important. Eating
smoking,
healthy,
staying away from
smoking.
That's
all
right.
These things affect the immune system adversely.
Yep.
So there's a lot that we can do beyond, supplements that
Absolutely.
make a big difference. And they probably make a bigger difference, quite honestly.
Yes.
So the other stuff is just the icing on the cake, I guess. But the most important thing is the mask and the hand washing, no doubt.
Yes.
Absolutely. So we had talked a little bit about the monoclonal antibodies, and we know they don't work as well with this variant. But is there any role for them or any particular monoclonal antibody that's still effective in your
At this
experience?
point, I did not, I have to be honest, I did not look that up recently because we have not been using it.
I haven't ordered it in a long,
That's right,
long
exactly.
time. So it doesn't really come up much anymore with Paxlovid and that available.
Yes, and also because you have to give it IV, and then it's like a little bit of a pain. But also now is some reports that is not working as well.
Right.
We had at one point, and we talked about what is monoclonal antibodies is just, made in the lab to kind of give coverage and to eliminate this virus from your body. Mm-hmm. How did it come along? Because we used at the initial disease, the plasma of people who were sick. So basically extracting those good proteins and antibodies from people who were sick. And we know that at one point it was working, and when not working, we do know that the plasma, it works, or convalescent plasma, but only if it's high concentration of antibodies. Now they can measure it. And again, can that be used even now? Yes. Now they actually at the blood bank, they measure it and they can tell you if high levels, high concentration of that antibodies or neutralizing antibodies. We use it mostly in hospitalized patients. Mm-hmm. Okay. We leave it up to them. And then is that effective against BA5? We don't know. We don't know if that plasma is coming from a person who had Omicron or not.
Right, we don't really know.
We don't really know. So we still have remdesivir and can be used. Okay, even as an outpatient, it still works. We can give it. It's still an infusion, but it's free infusions 3 days in a row as an outpatient. Okay. So that can be used as well. We use it inpatient, outpatient. And Paxlovid is still, I think, is the way to go.
I think I agree with you. That's what I've been recommending mostly to my patients, and it does seem to work in many instances.
Yep.
Most instances, actually.
Yes.
So that's great. So I think we're getting towards the end of our time here.
Too.
We went through so much. This was great. Is there any one message you want to leave our audience with?
Oh, what can I say? Let's all, work and do our part in this so we can get rid of this virus. I don't know what to tell you, to minimize the outbreak in fall. I think that we need to get the booster with Omicron in it.
Right.
And people who did not get vaccinated because they had different concerns. Now you have actually this Novavax that is made on protein based, is the same kind of vaccine that we have been using for decades, many, 20, 30, 40 years in hepatitis B and varicella zoster and I think papillovirus. And I think that they should get this Novavax this fall. So we are over this, Otherwise, we're going into this vicious cycle, and it seems that will never end.
Right. I think, as I mentioned, there's a lot of fatigue out there. People are tired of dealing with this, but we have to keep doing it. We have to keep wearing our masks, washing our hands, get vaccinated, because it really does reduce the numbers and reduces the risk of the disease. And we don't know what the long-term effects are.
Yes, and reduces the deaths.
And it reduces the deaths, of course.
Yes.
So it's a great message. So I want to thank you.
Thank you.
Once again, a wonderful podcast, a lot of information. I think everyone learned something, and you did a great job last time and a great job this time.
Thank you so much.
Thank you so much. And I want to thank Bay Coast Bank. Bay Coast Bank is just right for all your financial needs. Visit baycoast.bank or call 508-678-7641 to learn more. So once again, thank you for watching our podcast. This is the 27 Degree with Chris and Nancy from 27 Degrees Consulting. Have a great day, everyone.